pregnancy safe except for
everything except for night watch.
which is this one.
So yeah, retinol, tretinoin, any variation of that topical, we advise patients to avoid during pregnancy.
Okay, or holes like this.
Okay, cue it for everyone can see it.
Sure.
Okay, so what do you want to do?
Okay,
Through a list or do you want to have more? Okay, would be fun.
I think so. Yeah, I tried to kind of hide mine. Yeah. I'm Hailey, and I am the physician assistant here at SkinPharm in Raleigh.
And I'm Laura Balzaccieri, and I'm one of her patients. So today we're going to talk about a hot topic, which is pregnancy skincare. So in case you missed it, Hailey is pregnant, so she's kind of been walking the walk. So we have a lot of questions that we can ask you and go from there.
I'm currently 36 weeks pregnant, and we have a good amount of our patient population that is in that demographic that is currently pregnant or trying to conceive. So we thought we would just touch on some nice topics about skincare and skin treatments throughout pregnancy.
Yeah, we start from like the beginning
Yeah.
of like the process. Like, so if you're trying to conceive, is there anything that you recommend like staying away from? Anything that you recommend treatment-wise doing now? Or
If you are trying to conceive, I would say trying to stay on top of your injectables would be nice, just because, you know, staying on time with your tox treatments. That way, when you do find out you're pregnant, if you're up to date, hopefully your past treatment will last you well into your pregnancy.
so I feel like you're probably one of the first to find out if people are pregnant, because you have to make sure that you don't do like.
Indeed, yeah, definitely one of our top questions that we ask patients when they come in for their treatment is if they're currently pregnant or breastfeeding. And I would definitely say the most common treatment we do here as far as injectables go is Botox or Dysport and filler, which are not pregnancy or breastfeeding safe. So try to stay up to date on those and get those while you're trying to, prior to getting pregnant.
So you just said about actives, like staying away from actives, and any like specific products that you guys have here that are not, you wouldn't recommend during pregnancy or.
So as far as all of our skincare products, there's only one product that is not pregnancy safe, and that is our Night Watch, which is our retinol. So my patients, I would say out of the topicals that they're on, the most common one that I have my patients using that I have them stop in pregnancy is either our Night Watch or their prescription strength tretinoin. There are some others out there, but just be sure once you do find out you're pregnant, have a conversation with your provider to make sure that we get all that straight. Make sure you're not on any medications that are not safe for pregnancy.
And what about treatment during pregnancy? Because I feel like some patients, like when they're pregnant, they think they have to stop everything and not get any treatments and just wait until the 9 months is over to start. Is there anything you recommend that patients can still get during pregnancy?
Yeah, so we have several treatments that are pregnancy safe. We just do require you get OB approval before coming in for the treatment. So the most common treatments we do on our pregnant patient population, I would say, is microneedling. We can do that with,
Can you do that with PRP?
Yep, you can do it with the PRP. We just require OB approval for topical lidocaine for that. Same with our gold infusion, which is another needling treatment. We just require OB approval for topical lidocaine. And then,
Is that with the Botox in the gold infusion, or
so
do you take that out?
just the gold infusion, you can either do the basic gold infusion or you can do it with the PRP.
Okay.
And then you can do PRP injections, which we can do, you know, under the eyes most commonly is where we do them, but you can do them in other areas across the face or for hair restoration. And then the BBL, which is a type of photofacial, is also safe during pregnancy with OB approval.
Okay. You feel like acne and melasma, like what is the most common that you see during pregnancy?
I would say acne and melasma are probably the most common skin conditions we see throughout pregnancy. You know, there are several things we can do for melasma while you're pregnant. The microneedling with the PRP is a great one. And then, of course, being super diligent about SPF. Pigment just increases throughout pregnancy in general, even without melasma. So just like freckling and overall pigment of your skin. So being really good about your sunscreen, and then microneedling can help with the melasma. Now, as far as the acne, there are several different topicals that we can utilize that are pregnancy safe that can help with the acne that many patients get throughout pregnancy. I would recommend just getting a consult with a provider where we can really go over, all of your options and talk about the nature of your acne to come up with a treatment plan that's best for you.
Okay, walk us through your morning skincare right now.
Okay, currently I am using Power Wash cleanser, and then I use my Youth Serum, which is a hyaluronic acid serum, and then Glow Factor, which is our vitamin C serum, which is an antioxidant, which is really important also in pregnancy, helping with like all the pigment. And then after that, I use my High Beam in the morning, which is our lighter moisturizer, but it's also brightening. And then I use our mineral tinted SPF every day. And then evening, very similar, except pretty much all the same steps, except I do not use the Glow Factor in the evening. And I use our Crystal Clear pads, which is, those are toning pads. They have lactic acid, salicylic acid, and glycolic acid in them. So they're great for brightening, also great for texture, pore size, acne. That definitely has been my saving grace throughout pregnancy while I'm not able to use my retinol or tretinoin. I think those pads have helped me a lot.
Show some products.
Treatments, products. Yeah, we can show products.
All of our other products are pregnancy safe.
Combined, like a whole serum
Yeah.
one that you can't.
Yeah.
You can do everything except.
So that's why I tell patients to don't wait until after pregnancy to come in to get a good consult and talk about products that we can use to help your skin throughout pregnancy, because we have so many options and we can definitely come up with a good plan that's right for you. Thinking about some of my favorite products that we have that have saved me through pregnancy, I would say our Crystal Clear pads. I use these every day. Some patients, I would say, can tolerate them just like every other day, a few times a week, but that has been so great for just brightening, great for my texture. I think this has been my favorite moisturizer. It's a good brightening moisturizer. Mineral sunscreen is my favorite, so it's nice and tinted. It leaves such a nice level of coverage on the skin, and this has really helped, I think, with all of my pigment that I have been trying to prevent throughout pregnancy. But those are some of my favorites. Of course, the Glow Factor and the Youth Serum as well.
And what is the first thing you're gonna do after you give birth?
So after I give birth and once I'm done breastfeeding, I will be getting full face tox, re-upping on my trap tox, maybe even some tox to my underarms for sweating. And then I am thinking about doing a little bit of Sculptra, and then also Moxie laser to help with kind of some of, and the BBL to help with some of the pigment that I've acquired throughout pregnancy.
Okay. Are there any postpartum skin tips that you're planning to follow, or?
I will say I am going to try and give myself grace and just aim for consistency over anything, even if that means just giving myself 5 minutes in the morning to do my skincare to help me just feel a little bit more like myself throughout the day. So, just consistency over everything, which is what I tell all of my patients. Really the most important thing with skincare is just, trying to be as consistent as you can.
Do you get a lot of questions pregnancy-wise? What is the most common question you get?
Probably just what treatments.
What treatments
they can continue doing. Yeah, I feel like most everything.
What's been the most popular treatment that you've been doing?
On pregnant microneedling.
Microneedling.
Well, thanks everyone for tuning in. That was so fun.
That was so fun.
If anyone has any questions about anything, feel free to just comment with those questions. I'm always happy to chat.
I'm so sad. I'm going to be missing you for how many months? When are you going to be back?
I'll be back first week of January.
Oh my gosh.
I know.
That's so long.
Bye, you guys.